Senior Helpers asks the expert, what role does physical therapy play in helping our loved ones age in place?
Physical therapy has a vital role in helping seniors age in place. For one, it helps seniors maintain their functional mobility. We help seniors do exercises, but not just any exercises. You know, if someone's sitting in a chair and moving their legs around and doing exercises, I consider that more movement. But if they're doing exercises that are a certain dose, meaning it's just enough to get the desired effect that we want, but not too much so that they can enjoy the rest of their day. And you want to make sure it's task specific and functional. This means it should be an exercise that is meaningful to them, that helps them stay in their home for a longer period of time. An example of that would be standing up and sitting down, doing the stairs, and getting in and out of a car. You want to make sure that they know why they're doing it, and for most people, staying in their home is a big enough reason. A very simple example is the sit to stand. So I educate all my patients on how to do a sit to stand, but we don't just do it any old way, okay? So you want to see how they start, and then you want to make the exercise progressively harder because the body has the ability to adapt and change. If you give them a simple exercise, that's your starting point, but after they get to that, you have to challenge them. This creates a lot of changes in the body, a lot of changes in the brain, and once they get to that point, they won't plateau because you're going to be challenging them. So for the example of the sit to stand, if they get to, let's say, 10, then you got to make it a little bit harder, a little bit more intense, increase the load, make it fun. It's so important for the caregivers and family members to be educated on the exercises that will help seniors stay in their home longer. 90% of the patients that do get better with physical therapy usually have somebody with them that's helping them along with the exercises because we do require about 5 or 6 days a week of exercises, and we come there usually once or twice a week. So that's a lot of time that if they're not doing them, they're not going to get the desired results. So speaking with caregivers and showing them and having them come in on a session and learning the exercises themselves is critically important.